My name is Amun, right here on One with Amon, and you're very much welcome. It is the 3rd day of November 2021. Can you imagine how fast time moves? First of all, we begin by apologizing. Last week we were unable to share with you a video. Last week we had the Safe Motherhood Week in Uganda, and the whole week was swamped with activities moving up here and there, and big up to everyone who participated in the National Conference on Safe Motherhood in Uganda. What we are doing everything that we can to make sure that the people who are responsible for bringing us into this world do so in a safe manner. Today, we'll be talking matters HIV and AIDS. In today's show, we had planned that by the end of the interactions, the participants will be in position to do a number of things. Very many bullets, but they're very important and doable. 1, articulate basic facts about HIV, such as what is HIV? The other one is what is AIDS? What are the symptoms of HIV? In which body fluids can HIV be found? In which body fluids can HIV be found? How is HIV transmitted? What are the modes of preventing HIV? And what is safer sex? Thank you so much. So, someone will be asking themselves, what the hell, why on earth is Amon talking about HIV? I thought everyone knows about this. And that is the big mistake that we've been making all over. When COVID-19 came, people forgot about HIV. When COVID-19 came, people forgot about contraception. When COVID-19 came, people forgot about sexual and gender-based violence. And the only thing on people's lips was COVID-19. But we are here to remind you that actually, HIV is still here with us. It does not have a cure. It doesn't have a vaccine. And it is killing many people. So, for you who is watching me, one of the first things that we're talking about today is, what is HIV? For us to understand it better, we are going to break these letters one by one. H. What does it stand for? It stands for human. Human. Meaning, it attacks people, human beings. What does the I stand for? It stands for immunodeficiency. What does that mean? When this virus attacks your and my body defense mechanisms, it makes it lack deficiency. It makes it lack the strength to protect your body, to protect my body against infections. And the V, it's a virus. So you can see that HIV is a retrovirus that infects the cells of the human immune system and destroys or impairs the function. And the result is in progressive weakening of the immune system, leading to what we call immunodeficiency. And it has been realized that people with immunodeficiency are much more vulnerable, they are much more prone, they are much more susceptible, they are much more at risk to a wide range of infections and cancers, most of which are rare among people without immunodeficiency. And we're saying also that diseases associated with severe immunodeficiency are known as opportunistic infections because they take advantage of a certain situation. That's the reason you hear that whenever someone has HIV, the virus, the body is weak. So there are other diseases that take advantage of that situation to attack. Look at your country. Look at your national army. If the army is weak, other people take advantage of that, called rebels, and they will come in to attack. In this particular case, the HIV is the rebel to your body. You're still watching One with Amon Mulioa. So, now that we are done with HIV, human immunodeficiency virus, a virus that attacks human beings and weakens their body defense system, making it susceptible to attack. What other word are we looking at here? AIDS. AIDS. Just as we did with HIV, we are going to attack this one by breaking down the letters. What does A stand for? Acquired. What does the I stand for? Immuno. What does the D stand for? Deficiency. What does the S stand for? Syndrome. Now, HIV. AIDS? Are they the same? There's a question that people have always asked. We are going to answer that. So we're saying that actually AIDS is described as the collection of symptoms and infections associated with the deficiency of the immune system. Acquired refers to get. You get it. After what? After the immune system has gone into deficiency mode. After the immune system has lacked something. And when it lacks something, it makes your body weak to resist against infections, and if opportunistic infections take advantage of that and you get the AIDS. Is HIV the same as the AIDS? You should be answering that question. So you're saying that infection with HIV, listen to that, has been established. Infection with HIV has been established as the underlying cause of AIDS. Can you imagine? So which means AIDS and HIV are actually two different things, my listener. And we're saying that the level of immunodeficiency, the level of lack of immunity, the level of lack of body protection, or the appearance of certain infections are used sometimes, or in most cases, as indicators that HIV infection has progressed to AIDS. You know, HIV progresses along a number of stages, and we are going to be looking at that. But before we go to that, I want us to be clear. HIV is basically a virus. And when this virus attacks your body, my body, it weakens the body immunity, making that body unable to resist any attack. And when the body is unable to resist any attacks, it creates a situation called AIDS, where opportunistic infections take advantage and they come and start attacking your body. What else are we looking at? So what are some of the symptoms of HIV? Now here, I want to put a disclaimer that these infections can actually, I want to put a disclaimer that these symptoms could actually be symptoms of other infections. But we're saying that most people infected with HIV do not know they have become infected. Most people do not know. And immediately after the infection, some people may have a glandular fever-like illness with fever, rash, joint pains, and enlarged lymph nodes, you get, which can occur at the time of seroconversion. Seroconversion is that period when you've actually turned HIV positive. So, and that's what I'm saying, that seroconversion refers to the development of antibodies to HIV and usually takes place between 1 or 2 months after an infection has occurred. So, despite the fact that HIV infection often does not cause any symptoms, remember, a person newly infected with HIV is infectious and can transmit the virus to another person. And the way to determine whether HIV infection has occurred, remember, is by doing one thing, going for an HIV test. As I told you when I was starting the session, when I was starting on this particular subtopic of the symptoms, I said that these symptoms can actually appear in any other illness. But the best and surest, or the most sure way, that's something that someone can do and they establish they have HIV, is going for an HIV test. Go for your HIV test now, today. HIV infection can cause a gradual depletion and weakening of the immune system, which results in an increased susceptibility, an increased risk of the body to infections and cancers, and can lead to the development of AIDS. I've continued to say these words, HIV progressing gradually into AIDS. And that one brings us to our next discussion. So when does a person have AIDS? Beautiful question. So we're saying that, as you remember, I've been differentiating between HIV and AIDS because these two things are different. A question has always been asked, can someone have HIV but not AIDS? The answer is simple, yes. Someone can have a virus, the virus HIV in their body, and if that person is following the doctor's orders as given by the doctor, do not do this, do not do this, do not do that, they will keep their viral load so low that their body defense system or immunity is kept strong, strong to continue resisting any opportunistic infection. That is what we are going to be talking about, the stages of AIDS. So when does a person have AIDS? So we're saying that AIDS applies to the most advanced stages of HIV infection. And AIDS is identified on the basis of certain infections. For example, if a person is in stage 1, the HIV disease is asymptomatic and not categorized as AIDS. Asymptomatic means you cannot show any signs that you have the virus. This progresses to stage 2, however, where a person with this includes minor mucocutaneous manifestations and recurrent upper respiratory tract infection. That one progresses to stage 3, where a person experiences unexplained chronic diarrhea for longer than a month, severe bacterial infections, and pulmonary tuberculosis. This one progresses to stage 4, which includes toxoplasmosis of the brain, candidiasis of the esophagus, trachea, the bronchi or the lungs, and Kaposi's sarcoma, cancer of the skin. And the HIV disease are used as indicators of AIDS. Most of these conditions, however, as we have always been saying, are opportunistic infections that can be treated easily in healthy people. You're still watching me, Amon Muliowa, with your favorite online educative show, One-on-One with Amon Muliowa. We are talking about HIV, basic facts. What are some of the things that someone must know? 1, what is HIV? What is AIDS? Is HIV the same as AIDS? We have said no. One of them is actually virus, and the other one is actually a situation that is created as a result of having the HIV. So we have said that situation actually, the situation moves, it graduates from stage 1, stage 2, stage 3, stage 4, and it moves up to there. The other question you should be asking yourself is, can actually a person have, does every person who has HIV die from HIV? We'll get there, just stick here. So the other question, the other thing that we talk about is that in addition to the 4 stages we've talked about, the United States Center for Disease Control and Prevention defines AIDS on the basis of the CD4 positive T cell count of less than 200 per millimeter cubed of the blood. You can access more information on that URL on your screen. And we are saying that the other question is, how quickly do people infected with HIV develop AIDS? The answer is, the length of time can vary. The length of time can vary. Someone can develop HIV shorter than the other, longer than the other, but I'm saying that the length of time can vary widely between individuals. Why? And the time between infection with HIV and becoming ill with HIV can be 10, 15 years, sometimes longer, sometimes shorter, but sometimes shorter. And antiretroviral therapy can actually prevent progression to AIDS by decreasing the viral load in an infected body. So, where can someone find the HIV? Now, there's English I listen to amongst people, and I'm like, and someone said, where can someone find the HIV virus? You don't need to add the word virus if you've said HIV, because HIV is human immunodeficiency virus. So where can someone find the HIV, that virus? Where? The answer is, HIV can be found in body fluids, such as blood with the highest concentration, semen with a high concentration, vaginal fluids with a high concentration, and breast milk. So I've said that in all these fluids you can actually find HIV, though the concentration varies. But my question has always been, what concentration percentage do you need to get infected? How can HIV be transmitted then, is our next question. And we're saying that one of the ways HIV can be transmitted is through penetrative sex, which could be anal or vaginal sex, blood transfusion, and now mark here, I'll be pronouncing myself again on blood transfusion, not to scare people from using blood from our blood banks, sharing of contaminated needles in healthcare settings, and drug injection amongst drug users and between mother and infants during pregnancy, childbirth, and breastfeeding. Let's talk about sexual transmission as a way of transmitting HIV. We're saying that HIV can be transmitted through penetrative sex, as we said, and transmission through anal sex has been reported to be 10 times higher than transmission by vaginal sex. So this is where we come in and say, men who are having sex with men actually have a higher risk of transmitting, of catching, if I can use the word, HIV. Why? Because unlike the vagina, the anus, what men who have sex call the vagina, is not naturally made for sex. So it is not adapted to having the sex. So you find that if a person is having sex from the vagina, they are more prone to bruises, they are more prone to tears, they are more, even, so that's the reason, one of the reasons they're saying that a person having anal sex actually has 10 times higher risk than the person who is having vaginal sex. I'm not saying though that go and have vaginal sex with a person whose status you do not know because you stand a higher risk. There is equally a risk. So we're saying that a person with an untreated sexually transmitted infection puts themselves at risk of HIV infection, particularly involving ulcers or discharge, is on average 6 to 10 times more likely to pass on or acquire HIV during unprotected sexual intercourse. Oral sex, on the other hand, is regarded as a low-risk sexual activity in terms of HIV transmission. You're still watching Aimon Muliowa on One-on-One with Aimon, and today we are talking about basic facts about HIV. What is HIV? What is AIDS? Where can someone find HIV? In which fluids? How can someone, what are some of the ways of transmission? We have talked about sexual transmission. Men having sex, 10 times more at risk of HIV infection. People with STIs, 6 to 10 times more likely to catch or to acquire or to get the HIV if they had unprotected sexual intercourse with a person. We are saying that not when a person living with HIV is taking effective antiretroviral therapy, if you're taking your ARVs as directed by the doctor and you have a suppressed viral load, they are no longer infectious. They are no longer infectious. There is a term, one of my mentors, Dr. Elizabeth Kihika Opio from Alive Medical Services in Uganda, told me that U equals U. If the virus is undetected, then it means it is untransmissible. Take it this way. Get a grain of rice, throw it in a bottle of in a 2 liter mineral water bottle and shake. You'll take the water and not even notice the grain. That's what we are saying. That if the virus is undetected, then it is untransmissible. One-on-one with Aimon Muliowa. Basic facts about HIV. So I talked about sexual transmission. HIV can equally be transmitted through sharing of needles and syringes. And we are saying that reusing or sharing needles or syringes represents a highly efficient way of transmitting HIV. The risk of transmission can be lowered substantially, however, among people who inject drugs by always using new needles and syringes that are disposable or by properly sterilizing reusable syringes or needles before reuse. Transmission in a healthcare setting can be lowered also by health workers adhering to universal precautions. And the health workers know this. So, it can be transmitted through sexual intercourse, unprotected, with a person who has the HIV. Transmitted through, we're saying, syringes, needles, and other sharp objects. Transmitted through mother-to-child transmission. And we're saying that HIV can be transmitted to an infant during pregnancy, labor, delivery, and breastfeeding. Generally, there is a 15 to 30% risk of transmission from mother to child before and during delivery. I know a number of countries have embarked on projects. First of all, it was prevention of mother-to-child transmission, but then now it is called elimination of mother-to-child transmission of HIV. And of course, then the other one is that a number of factors actually influence the risk of infection from mother to child, and some of them include particularly the viral load of the mother at birth, and the higher the viral load of the mother, the higher the risk of transmission. And transmission from mother to child after birth can also occur through breastfeeding. That's the reason you are told that if the moment in Uganda, the little I know that the mother is diagnosed with HIV, they are started on ARVs, to make sure that they reduce the chance or the risk of infection to the unborn child. And we are saying that transmission from mother to child after birth can also occur through breastfeeding, and the chances of transmission of HIV to a child is very low, as I said earlier, if the mother is on ARV or ART therapy, antiretroviral therapy, during pregnancy and when breastfeeding. The last one I'll talk about for now is transmission through blood transfusion. Now, this is a big one, and when I'm doing my social behavior change communication classes to people, I don't mention this, but I just want to mention it that because we know that all our blood is actually very safe. The different protocols blood goes through to the time from the donor to the person who's going to use it, we make sure the ministries of health have made sure that the blood is safe. But it can't go without saying that actually there is a high risk, greater than 90%, of acquiring HIV through transfusion of infective blood and blood products. However, as I had earlier said, the implementation of blood safety standards ensures the provision of safe, adequate, and good quality blood and blood products for all patients requiring transfusion. Blood safety includes screening of all donated blood for HIV. This one is done. So don't refuse to use people's blood or blood from the blood bank because it is screened, okay? And other blood-borne pathogens, as well as appropriate donor selection. Ladies and gentlemen, you're still watching One-on-One with Amon Mulyowa, your online educative show. So thank you so much. Now, many questions. Now, let's just take off some time to go through some of these questions. Frequently asked questions about HIV and AIDS. One of them is, what is the risk of transmitting HIV through kissing or deep kissing? Now, to my friends who love kissing, what should I tell you? Here I am. So, transmission through kissing on the mouth carries no risk, actually. And no evidence has been found that the virus is spread through saliva by kissing. Of course, someone will tell, what if the saliva had blood? Remember what I told you. Risk reduction and risk avoidance. But in kissing, no evidence has shown that so-and-so got HIV through a kiss. What is the other question? What is the risk of transmitting HIV through body piercing or tattooing? The risk of HIV transmission actually does exist with this. If contaminated instruments are either not sterilized or are shared with others. So if you are tattooing or body piercing, we are saying instruments that are intended to penetrate the skin should be used once, then disposed of, or thoroughly cleaned and sterilized. So if you're going for the tattoos, the trending tattoos of this, you go put your biceps and they put the tattoos, please make sure that the body is actually, make sure that actually the instruments are thoroughly sterilized, or they are only used on you and they are thrown away. How you make sure that happens, I don't know, but that is the best practice. The other question is, what is the risk of transmitting HIV through sharing razors with an infected person? Now, my salon people, where we go to do beards, any kind of cutting using an unsterilized object, such as a razor or a knife, can transmit HIV. It can transmit HIV. Do not forget this, my people. Sharing razors is not advisable unless they are fully sterilized after each use. Two more questions and then we're done with some of these frequently asked questions. One of them is it safe to have sex with a person living with HIV? The answer is, having sex or sexual intercourse with someone living with HIV is actually safe if the person's virus is fully suppressed by treatment. Sex is also safe if a condom is used correctly and consistently each time you have sexual intercourse with them. Sexual intercourse is also safe if you are taking pre-exposure prophylaxis, PrEP, in accordance with your healthcare provider's recommendation. Is it safe for two people living with HIV to engage in unprotected sex exclusively with each other? And we're saying that it is best for someone living with HIV to avoid becoming infected with a different strain of the virus. This is called reinfection. Therefore, the advice given above should be followed, except for the advice about pre-exposure prophylaxis. Finally, how can someone prevent HIV? Sexual transmission of HIV can be prevented by monogamous relationships. Relationships where people or where one is mutually faithful to the other. I've always told people that mutual faithfulness is like a button on your shirt. A button has their particular hole where they go. Let that button keep going into that hole and let that hole wait for that button. That is mutual faithfulness. What else? You can avoid or prevent sexual transmission by having non-penetrative sex, consistent and correct use of male or female condoms. We shall be talking about these condoms in the next session. Sex between two people when one of them is living with HIV, but in taking antiretroviral therapy and has undetectable viral load. Remember, U equals U. Undetected equals untransmissible. Pre-exposure prophylaxis taken by people who are not infected with HIV. And then doing what we call voluntary medical male circumcision, which reduces the risk of men acquiring HIV from women to at least 60%. Other ways one can prevent themselves from HIV include, if you are an injecting drug user, always use new needles and syringes that are disposable, or needles and syringes that have been properly sterilized before reuse, or opt for other prevention measures such as opioid substitution therapy. Finally, ensure that blood and blood products are tested for HIV and that blood safety standards are implemented. When you talk about sex and HIV, there's one word that you can never miss out on, and that word is safer sex. I was conducting a training by one partner in Kampala, and they kept on using the word safe, and there's like, in social behavior change communication, there is no sex that is safe. Sex is only safer. Safe means there's no risk in it, but there's no sex that doesn't have a risk. So we only make it safer by adhering to certain protocols and procedures. So what is safer sex? I was saying that safer sex involves taking precautions that decrease the potential of transmitting or acquiring sexually transmitted infections, including HIV, while having sex. Using condoms correctly and consistently each time one has sexual intercourse is considered safer sex, as is oral sex and non-penetrative sex, or taking pre-exposure prophylaxis if you are at risk of HIV infection, or having undetectable viral load if you are living with HIV. U equals U. If it is undetectable, then it's untransmissible. How effective then are condoms in preventing HIV? And we're saying that quality assured condoms are the only products currently available to protect against sexual infection by HIV and other STIs, sexually transmitted infections. And it is said that when used correctly and consistently each time one has sexual intercourse, condoms are a proven and effective means of preventing HIV infection among women and men. And in order to achieve the protective effect of condoms, they must be used correctly and consistently. Incorrect use can lead to the condom, can use to condom slippage or breakage, thus diminishing their protective effect. The question I want to leave with you, and that's what we will start with next time. How does one use a condom correctly and consistently to reduce the risk of HIV, sexually transmitted infections, and other sexual and reproductive health risks? Amon Mulyowa is my name. Thank you so much for keeping it here on One-on-One with Amon Mulyowa. See you next time.